Hey guys, great interview today. So we have Dr. DeMars, owner of NeurOPT here in Jacksonville, Florida. She's a neurological clinical specialist. She goes to people's homes. She helps treat common conditions such as vertigo, balance, and strokes and other neurological issues that people may be experiencing. It's a great interview. We talk about how she got started. We talk about our favorite things to treat. We talk about vertigo. We talk about what are the things that she likes to tell people about balance and how they can improve their balance. And so if you want to check it out, feel free to just continue watching the video. Hope you guys getting something from it. And as always, if you have any questions or comments, feel free to reach out. All right, Dr. DeMars, thank you so much for joining me today. You are the owner of NeurOPT here in Jacksonville, Florida. You've been around for a bit. You treat neurological conditions. You are board certified and a neurological clinical specialist, but I don't want to take too much thunder away from you. Please tell me a little bit about yourself and what you do.
Well, first, Dr. Derry, thank you so much for having me and giving me this opportunity to share about myself and NeurOPT. I started my practice about a year and a half ago here in Jacksonville, Florida. And as my name sort of alludes to, I do focus on the neurologic population. So some people ask, well, what does that mean?
Yeah.
So neurologic, it's a disorder that affects the brain or the brain's connection to the body or how the body moves.
Wow. Yeah, it's a good description. Yeah. And most common condition you see, what would you say?
I don't know if I can narrow it to one, but I
Sure.
do see a lot of people who've had strokes. I also have a fair number of people that have vertigo, which generally that is from the inner ear. So I treat that as well.
And I've noticed people who know of vertigo is usually because they've had it themselves, and it's absolutely terrible, right?
Yeah.
And so I know in your practice, you go to people's homes and you can just really take care of them there. Do you find that people find a lot of value in that?
Yeah. So like you said, vertigo, apparently, knock on wood, I've not really experienced it myself, can be extremely debilitating.
Yeah.
It is quite common. I don't think people realize that. And the most typical form is treatable. Okay. If it's from our inner ear, it is treatable, which is good. I do go to people's homes. I'm mobile. That is helpful for those experiencing vertigo. The last thing they want to do is get in the car and drive. It might not even be safe for them to get in the car. So I do come directly to them. People with vertigo, I take a special preference towards where I see them right away if I can, because I know it really affects being able to work and, take care of your children and every aspect of your life. So if I can get in there right away and help somebody, I mean, that's the most awesome thing.
Yeah, absolutely. And, I only know very little, but what I do know is that the success, if it's treated quickly and you can identify the type of vertigo, is very high, very, very high.
Yeah, like a lot of things, if you get it treated, sooner, more acutely, you do a little bit better.
Yes, but very different than me in that I see patients for 10 to 12 visits or so, but vertigo is, you can notice have a large difference a little bit quicker than that, right?
Yeah, my average number of visits for someone with vertigo is 4 visits. So I'll come to the home, 4 times. And that can be spaced out. I'll give people things to do in between, and then they're generally good to go at that point.
That's so nice. That's so gratifying. So why did you become a neurological clinical specialist, and tell people what that is?
Okay. Well, when I graduated from physical therapy school, I knew I wanted to work with this population. So I worked in several different areas trying to gain as much knowledge as I could, really, and enough clinical skills. I worked in inpatient rehab, in the hospital bedside. I did outpatient, I did home care, I did nursing home. I really tried to do a little bit of everything because I knew I wanted to open my own practice eventually. So I wanted to be prepared and be able to best serve my clients. I became board certified in neurologic physical therapy in 2013. So I graduated in 2010 and I did my certification in 2013.
Very nice.
just helps me stay up to date with the current research and the current evidence for the neurologic population, because I do have to maintain my board certification over the years.
Absolutely. That's a good thing, right? Get to stay up to date.
Yes, I need to renew. I'm renewing this summer. So yes, a little like reminder, gotta get all my things into them.
Yeah. Yeah. I hear you there. And so you always knew you wanted to start your own practice. So tell us a little bit like why you started your mobile practice. Why do you love it? How is it different than you've done before?
Well, I guess as a new grad, I didn't know I was going to be a business owner. Like when I was in physical therapy school, that was probably the farthest thing from my mind. I was not, we weren't really trained. We definitely weren't trained to be business owners or the business side of things. So I really wasn't thinking that. I was thinking I was going to go work for somebody else, work for a corporation or a hospital like I initially did. But however, I realized, there's a lot of limitations with that model. And I was getting a little bit frustrated with not being able to see somebody exactly how I wanted to, or being able to use all the skills that I had, or I would see somebody and then the next time somebody else would see them. So I didn't even have that continuity of care. So when that was happening, I knew that I wanted to start my own practice so I could really see somebody from start to finish and just do exactly what I felt they needed. I'm my own boss and treat them how I want.
Yes. And I think your patients, among many patients out there, would echo their frustrations with the healthcare system and the inconsistencies and the barriers. And what you're doing is really help, kind of going against the grain a little bit, but really addressing those issues that people are experiencing.
Yeah, I think so. I have a lot of, I feel it's very worthwhile. I get a lot of, self-worth from it. So.
Awesome. I know you're doing an awesome job. I definitely can appreciate that. So what do you wish people knew about neurological conditions? Like, I know it's a very broad term. There's a lot of diagnoses that sit in there, but what you see the most, or what you really are passionate about, what do you feel people should really know?
I guess what I like to tell people, and even like students of physical therapy and other physical therapists, is that although you're treating the person's body, what you're really adapting is the brain or the spinal cord, wherever the neurologic injury is. So although it appears that I'm like working on a muscle or working on like this body part, really the underlying change I'm trying to make happen is to occur in the brain. So I think that's just a little bit different than, it's not purely like I'm going to strengthen this muscle. Instead, I'm going to look at initiating the muscle, coordinating it, sustaining the movement. So it's a little, I don't know, it's very particular and specific in that regards.
Yeah, I think a lot of people don't appreciate the complexity until unfortunately they've went through it themselves or have had a family member that have gone through it. And so I imagine that you work closely not only with the patient, but if needed, their family as well. Is that true?
Sure. I mean, a lot of times family members are present. Once we build up that trust, it's kind of nice that I can tell people, go run an errand, go take a nap, because people who are caregivers, I mean, caregiver burnout is a real thing.
Absolutely.
But getting the family involved in regards to, this is how I'm trying to have the person move and explain things is great. I love when people ask questions. I'm told this all the time, and I see it as a compliment that I do things very different than other places they've been. I focus my attention on things that like were not even on the radar previously. So that's how I try to set myself apart.
Well, absolutely. And I mean, I know you're doing that, and just providing that one-on-one attention in the patient's home, like, just provides so much value. Like, there's so much there. And it just helps with, getting to the sessions. Like, you don't have to worry about that. You just remove another barrier for them. So it's
I know this because you're mobile too, but if you're working with someone in their house with maybe their own equipment or their own space, then you're really tailoring it exactly to what they have. So when they have to go repeat it on their own or do something on their own, it's already set up for them. They don't have to transfer that knowledge to a different space, which is why I really like treating people in their home.
Yeah, yeah, absolutely. Like I've been in the big, I mean, you've been there too, in the big neurological centers, and they have all this fancy equipment, but then like how like it's a challenge to get that translate to their home environment. And then if it does, like it's, the patient's doing a lot of learning on their own and with their family, but now you are you're a doctor of physical therapy with your neurological clinical specialist, really looking at their home environment and dialing that in, not only for safety, but to allow them to improve. And so you really can't ask for anything better than that.
Yeah. And people sometimes are, because they've come from maybe a big gym environment, are worried about like the size of the space they have or like what they have.
Sure.
And really truly can make it work with whatever anybody has. I mean, I do bring things that I need to bring in, that I can reasonably carry, but no matter what the space is, like we can make it work in that environment.
Absolutely. So I know balance falls underneath you as well, right? So balance conditions. And there's a fair amount of older adults, especially, that are like, man, I notice my balance is declining, or it's just not the same as it used to be. What are your like top 1 or 2 balance tips you give to individuals?
Yes, a lot of people have different balance impairments. Well, if I'm just going to give like someone a tip, it would be to have like a more well-rounded exercise approach. You do need to have your cardiovascular, your aerobic, getting your heart rate elevated. You do need to add in the strength. You need to add in the flexibility, because to recover our balance, if we go to lose our balance, our muscles stretch, but if they don't stretch and they just sort of like stop, like that's kind of like where we like stutter and like, so you do need a well-rounded approach. You can do balance training. You can train your balance system like you can train other systems. I don't think people always realize that. So challenging your balance is really the only way to improve it.
Yeah, which requires to be a little uncomfortable, right? And so sometimes it's really hard to do on your own. But I like that you mentioned that when you look at balance, you're looking at other systems involved as well. And I think people need to realize that balance is more than just standing on one leg. Like that is not balance.
The first thing you learn in physical therapy school, because it was about the first thing I learned, that you need to be able to stand on your leg for 30 seconds on one leg.
Yeah. Is your balance normal? 30 seconds. Yes, it is. Yeah.
There's more to it than that.
Absolutely. Absolutely. And you are, one of the few providers that seem like they really take the whole system, right? They look at the patient as a whole. And since you don't have the limitations or barriers that you had in the past, you can really provide them with the best care and the right amount of care at the right time. And so, there really doesn't sound like there's a better scenario for that patient to be in.
Well, you summed it up nicely, I think, and that's what I strive for.
Yeah, absolutely. Well, I know you're doing really, really good things. You are mobile in Jacksonville, Florida. I know that you kind of travel a little bit of different parts of Jacksonville as well, right?
Yep, I will travel throughout Jacksonville. I go to Atlantic Beach. I go to Fleming Island, Ponte Vedra, Jacksonville Beach.
Very good. And easiest way for people to get a hold of you, is that through your website, email?
Yeah, they can go to my website. It's Neuro Goals. So neuro is NEURO, and then goals, like a soccer goal.com. And you can contact me through there. You can find me on Facebook by the name NeurOPT.
And it's only you, right? So if they call, they get a hold of you, they schedule with you, and you're their provider throughout.
That's correct. It's a one-woman show over here.
That's right. It's all it needs to be. You're killing it. Awesome. Well, I really appreciate your time. Thanks for just kind of scratching the surface of your background, where you've been, kind of the things that you really love treating and what people should know, and that you are, considered an expert in your field and very willing and able to help many, many people out there.
Thank you so much.
Yeah, you're welcome. Well, enjoy the rest of your day. Appreciate your time. And once again, thank you.